Hey, everybody,
Hi, I'm Dr. Burris.
and I'm Dr. Kim, and we are Coachella Valley Direct Primary Care, and today is September 9th, and it is our COVID 19 update show for the.
Today's September 1st.
Oh, sorry,
Yeah, it's 2022 and
2020.
20. Oh, yeah.
All right,
This is not a good
cut.
start.
Welcome, everyone, to the COVID 19 show. I'm Dr. Kim.
I'm Dr. Burris, and today is September 1st of 2021.
And we are here
Yeah.
to talk about the state of COVID 19, mostly in our valley, see what's going on, and um, that's mostly you. You look at the numbers. So, how are you doing today?
I'm doing good. It's cooled down a little bit.
Yeah.
So it's much more enjoyable to be outside right now. So I'm trying to take advantage of that and get out a little bit more than I could a couple weeks ago.
Although we had to survive the haboob yesterday in order to get the
Yes.
cooler weather. So
Yeah, that's true. It's a trade off. But might as well enjoy the cooler since we had to live through the haboob. So
right.
there you go.
Not that this is not a medical show, but why don't you tell people what a haboob is? It's not
Oh,
an anatomical part. So.
no. It is an Arabic word for sandstorm, basically. And here in the desert, in certain times of year, we're a little more prone to wind, and sometimes the wind really kicks up quite a bit of sand, and it becomes almost like a whiteout in a snowstorm. And sometimes you can't drive, and you do have to pull over. But it's really hard on your paint job and your headlights in your car.
And your eyeballs.
Yes. And this is the one situation where most people prefer to wear a mask. Yeah. Honestly, it really helps to have a mask on if you're caught outside in one of these.
Yeah. And I would imagine there are a lot of people out there going, oh, do I have COVID or what's going on? Because they have a runny nose and watery eyes or sneezing because of the haboob and the allergies I'm suspecting today.
Yeah, and it can actually be a little difficult to tell the difference between them, especially in a vaccinated patient, because they can have very mild illness and it can look like allergies. So if it lasts for more than a day and it's you have any concerns, definitely get tested.
Yeah. Anyway, shall we go to your numbers?
So let's look at the first slide that we have today. This is our daily report, and the one that I could find, the last one was from Monday. And so what you'll see here is what I'm going to call this is a lag in the numbers because this, we're seeing it sort of plateau out, but that sudden drop down is not real. Those are numbers that have not yet been counted and applied to those date ranges. The same is true with those number of new deaths. Sometimes it does take 24 hours or so for deaths to be recorded by the public health department and then reported out in their data, because not only does the hospital have to report it, but then it has to be sort of go through a process where it's confirmed and then reported out again. So often there is a lag. And we know that even in the Coachella Valley, we've had, more than one death per day. And in the county, we're also having more than one death per day. So I think this is a fluke really of weekend reporting because these are Monday's numbers. And I think when we see this week's update come out from the county, that number is going to really have jumped. And represented by this, if we look at the ICU and hospitalized numbers here, if we go down just a tiny bit, probable cases, yes. So probable cases are, a definition is cases that were considered most likely to be COVID, but didn't have a positive PCR. So there are many more COVID cases than are counted. Um, most estimates are about 5 times as many cases that are reported are actually out there in the community. And some of those we capture on other kinds of data collection, and that's represented in those probable cases. Um, but you'll see that number. I probably wouldn't follow it because they've kind of changed how they count it over time, but it's something they report out. That's why there's a little asterisk next to it. I wouldn't worry about it or pay attention to it, honestly. Um, in too much, I guess I would say. Our current hospitalized is 661, and the current in the ICU is 140. Again, this is a data is a couple days old. This number has continued to climb, and that number in the ICU is really concerning because a fair proportion of those patients um, are on ventilators, and being on a ventilator for COVID is very serious, and those patients are at high risk of dying. And so that's a lot of people to be in that precarious situation right now. And I'm concerned, hopefully what we'll see is that we've plateaued out now from our Delta surge. And you'll see that with our cases down at the bottom graph there, that bar graph. It's okay. So here we're coming down into the testing data, and this is our positivity rate. And you'll see, again, it lags a little, so we just kind of have to watch trends, but our trends are coming down. So 10.5, 10.3, 10.0, this is movement in the right direction. And again, when we're up in this positivity rate that's over 5%, that indicates that we need to be doing more testing. But the trend is in the right direction. Okay, let's go to the next slide. So I wanted to just kind of give us an update on where Riverside County stands as far as vaccination rates. And you'll see that we're kind of, I would say we're on par with the rest of California here in Riverside County. Maybe even a little bit ahead of California in general. We've got almost 54% of our population that's over 12 fully vaccinated, and 62% of our population at least has one shot. So we're getting there. It's slow. I feel like it's kind of like we're trying to wade through a river of molasses to like get to the other side with our vaccine percentages. And we'll kind of come back to that in a little bit, but I think we have one more slide. Yes. So this is our weekly report for the Coachella Valley. And you'll see here we have one weekly death reported out as of August 30th. Again, Eisenhower put out their records today showing that they've had 10 deaths this week. So again, the reporting lags, and next week we're going to see this deaths, our weekly deaths really jump, because it's not just Eisenhower who's had COVID patients having problems. It's both Desert Regional and JFK. So we're seeing the impact of the surge from Delta. We're still seeing a brisk number of new cases. We've got that 916, we're around 1,000. And let's go to the bottom. And so here you see, that slow increase in our ICU rates, creeping up every day, and then our positivity rate sort of staying similar to the states and the counties at around 10. So we're doing okay. I think we're getting through the surge of the Delta, but now we're seeing the impact of that surge in our hospitals. It always lags. And that's why when you first see the Delta cases go up, everyone's like, oh, it doesn't matter because no one's in the hospital. And I'm like, just wait. And sure enough, now our hospitals are filling up again. So that is it for our slides today. So, do you have something you want to talk about? Because I kind of do, but I don't want to overstep.
For COVID, no, not really. I have other things I want to talk about, but not
Okay.
for this show. So
Okay. So
I have a lot to talk about, but
always. I wanted to talk a little bit about sort of discussions around COVID and the issue of shame, because what I've started to notice sort of happening more and more is that people are afraid to talk about it or afraid to share their experiences or afraid to ask for help, for a lot of different reasons. But one of the ones is I think that people are afraid they're going to get, you know, um, shamed or get like people jumping on them. Like, if you do contract COVID, are people going to like, rub it in your face? If you're choosing to get vaccinated and you're in a community where that's not encouraged, um, people are hiding that information. People are coming to the doctor, and I will tell you, this is not uncommon. People are coming to the doctor with COVID symptoms who are refusing to be tested. And this is a real problem, because if we have a surge and there are people out there who have symptoms of COVID and they're avoiding testing, that's a sure way to keep this surge going. And partly, I think it's because of the implications of a positive test on the rest of their activity, be it work or school. But it is something that's really bothering me. Like, I wish people felt that they wanted to get a diagnosis, they wanted to get tested, and that if they do get COVID, that they're willing to tell people they've been around so that those people can be on the watch. If they do get vaccinated, that they feel comfortable being vaccinated. If they're not vaccinated and they do get COVID, that they reach out to their doctor because they're at risk and they need someone to kind of help walk them through that. So I do not shame people for their choices. It's just, you meet people where they are, you give them the best advice you have, you try to understand what people need at that moment and try to help them where they are. And that's my job as a doctor. And honestly, I'll keep doing that even if people don't take my advice. It's just sort of, that's how it is. People do what they feel is right, and I'm available to try to help them. I was just kind of feeling strongly about that, because I do feel like I've had several friends recently who maybe had COVID and not felt comfortable even telling anybody. And they're like isolated and at home and no one's helping them. Whereas they may have had more support if they had felt able to reach out to their support system. What do you think about that?
well, I suppose it's what are your views about COVID, and then what are other people's views? And by that I mean I'm gonna tell a story. So Rob Corman, I know you're never gonna watch this, but if you do, I apologize. So got a good buddy, Rob Corman. and we were out on a friend's boat, and we picked up a spider crab, which is a sea creature. Now, Rob Corman is deathly afraid of spiders. Crabs, no problem. So this thing looks like a spider, but it's a crab. So he was holding it, and we're like, "It's a spider," and he was like, "Ah!" He drops it. No, but it's a crab, and he picks it up. But it's a spider, and he drops it. So, I bring that stories because I think it really depends on how people view COVID. Is COVID, worse than or not worse than a cold? Is it like a flu? Is it really, what is it? I think based on that, then, if you hang around people who believe the same as you, then I don't think um, they, well, either way, right? It's a double-edged sword. If they find out, oh, you have COVID, then they might judge you. What have you been doing? Or, some people might not think COVID is a big deal. So why should I tell anyone? Because I don't tell people I have a cold. Right? You don't go around telling people you got a cold. So
I haven't had a cold in 2 years. Okay.
Okay, back when you did have colds.
Okay.
So I guess it's a very complex thing, but I do think the shame is there, and I think it not just COVID. I think there's a lot of things that are going around in different areas of people's lives that dealing with how do you approach people with differing opinions, and some people are very vocal about their opinions and some people aren't, and so I think for sure
I don't think shaming is ever the right approach.
Right. Absolutely.
For almost anything. Like I can't think of anything. You may be angry about somebody else's decision, but it's not really effective to shame them. I feel like people get either very defensive or they cut you off and stop listening to you. So it is a problem that's impacting our ability to stop the pandemic. Because if people feel shamed, they won't listen to you. And the medical community is notorious for talking down to people and shaming them and wagging their finger. You're a smoker, you're overweight, you eat at McDonald's, whatever it is. And usually what that does, in my opinion, is cause people to sort of not tell you the whole truth. And then you don't get the whole truth, so you don't make good decisions. Or you start to recognize that your patients are maybe withholding some of that information. And so I feel like that's a problem with this pandemic on so many different levels. And I just want to put it out there. If all you control is your words, your sphere, the way you treat people, and yet change happens and starts with one person. So I'm going to work on this. I think I'm hoping other people do as well, just to let people know that the more we can talk about honestly and openly and non-judgmentally, I think the faster we'll be able to actually handle this.
Yeah. And I think we're like any public health measure. It's, smoking probably was like that at once, right?
Oh, I remember, people screaming at community town halls about the smoking policies. Yeah. So it's not that. Hey, Jenny. Yeah.
Do you want to read the comment in case some people can't?
Oh, okay. Jenny Porter, who is a doctor up in Seattle, she says a lot of stigma or minimization around COVID testing and disease. Background of a culture who's about labelizing and dehumanizing the other is really problematic. Enough finger wagging. We need to be bridge builders who listen first. Ask, tell, ask. It takes a lot of patience and grace and time. That's so true.
Yeah. So I know you were saying that before. Smoking was the same, and now we've, as a society, have agreed upon most places you shouldn't
Yeah.
smoke. There are laws, signs, and most people aren't, up
Oh,
in
I
arms.
remember the uproar about requiring helmets on motorcycle riders. I mean, that was like, you know, not a popular public health movement, but it saves a lot of lives. So, you know,
Yep.
all right.
Is there anything else you want to talk about? That's about 20 after. We probably should get to our other show.
Yeah. Has COVID shame impacted me? Yes, because people like don't tell me the truth, and they won't tell me while they're really here. And then I go into the room and then they tell me that, oh my goodness, they have all these symptoms of COVID. I should have been wearing all my PPE. So now I just wear all my PPE because I've had that happen so many times. So yeah. And I think it's because people are kind of in denial or shame. So yeah, it's like made my job more dangerous.
I wouldn't know if it was made more dangerous. You just know about the danger more because they would have been there or not.
Yeah, that's true.
The danger's
but
there.
still.
It's just you're more aware of the risks now. So
Yeah. Okay.
sorry.
I look like a spaceman now. Oh well.
Well, so we are moving our show to Mondays due to kid pickup changes in our own personal lives. So we will do our shows Monday at 3.
But not next week because it's Labor Day. We'll start the week after Labor Day on the 13th of September.
Yep. So until then, if you haven't got your vaccine, we strongly recommend that. Continue to social distance and wear masks, even if you're vaccinated, especially indoors. And we hope that the numbers will start plateauing and coming down, although I suspect we probably have another week or two of rising numbers. But
yeah, we'll see what happens in the schools. Right now we're having hundreds of people across the Coachella Valley who are in quarantine from school exposures. So we'll see what happens with those over the next 10 days.
Yep.
Okay.
All right, everyone, have a safe Labor Day weekend.